And we are finally live. The date is 30th April 2021. I probably wouldn't forget this day because this day will go out in the record where India lost uh, one of its finest journalists. Uh, I I don't know what to say. I mean, I'm out of words. I remember I was in Delhi. I did my journalism from there, and the India Today office was just walking distance from our college. And I watched Mr. Astana. Didn't know him personally. He oftentimes came to our college for as a guest lecturer, and I remember the young journalists looked up to him. We might not agree with a lot of political stance that he takes in his broadcast, but we always looked up to him as a senior journalist. And he was supportive. He was the nicest person. And the junior journalists, the interns, everybody looked up to him. Maybe not the political kind, but his presentation was definitely one of the best we got. But we don't have it anymore. My condolences to his family. He got two little children, and it's really hard to see that. He died of COVID-19, which brings us to our topic today. Because we have covered this in our last broadcast as well. We talked to a doctor. We talked about different metrics of coronavirus. How could we manage it? But now we are going to specify it a little bit more. We're going to talk about home quarantine. How could we save ourselves by ourselves, right? How to safeguard the life of the loved ones, because once you're quarantined, you should sort of not only protect yourself, you're also protecting others. There are a lot of other people at stake here. Corona is a tricky disease because it not only literally sucks the life out of you, but even after the death, it emotionally tortures you. So we're going to talk about an array of topics related to it. Without a further ado, I would like to call upon the screen an expert in this field. He's a consultant diabetologist and a professional doctor. He's from Agartala. He's very knowledgeable. We have had a show before. May I call upon the screen Mr. Basab Ghosh?
I'm really honored that I got the opportunity to talk to this forum once again. And last talk was on 24th of April. And today, as you mentioned, Saurabh, it's a hard day for us because we lost another journalist also of Guwahati, I think Mrs. Nilakshi Bhattacharya, Mrs.
Yeah.
Nilakshi. So two journalists you lost in one day. And today our topic is home quarantine, how to manage home quarantine in COVID-19.
Exactly.
And we lost a very young person in our state, Tripura. There is a 13-year girl, and she reported late, and when she was in the hospital, she was dead. So home quarantine is very, very important. Then how long it should be extended, and when to report to the hospital. So this
Exactly.
particular thing is very, very important. I think we'll proceed one by one up to that level.
Let us start with the timeline here. Let's say if you get corona, you test, you have the symptoms and you think, oh, something is wrong, you get tested because that's usually the cycle. So you get tested and you get the report that you're positive. What is the timeline? You get positive, take it after that. What should the first thought be of that person's mind?
So when there is symptoms or there is some history of contacts, means somebody has come in contact with any positive person, then we are asking for COVID testing. So we in general do for RAT, rapid antigen test for everybody. And this rapid antigen test, if it is coming negative, then we are not doing anything if the person is not having any symptom. If the person is symptomatic, Then in spite of rapid antigen test coming negative, we are going for RT-PCR test. What is the difference?
Artificial
This
things.
actually, yeah, RAT, that is rapid antigen test, will come positive only with high viral load. But
Mm,
if we are missing anybody, then we cannot say this person is not COVID positive, because
mm,
low viral load is not detected in this one. Then we are going for RT-PCR test, where even the low viral load cases are detected with RT-PCR. So RT-PCR is actually gold standard for COVID-19 detection. So
mm,
once COVID-19 is detected, then
mm,
total more than 80% cases is
mm.
actually asymptomatic. There is no symptom at all.
Symptoms at all.
And
Yeah.
yeah, and another 10% is having very mild symptoms. So we can say around 90% is actually asymptomatic or very mild symptomatic. So though they don't require hospitalization, and our guideline also said they should not be hospitalized, so unnecessary bed occupancy will be less. So they should be on home quarantine, and if anybody cannot be in home quarantine, then they will be in institutional quarantine. This is called COVID care center. So in Agartala, we had COVID care center. In Bhagat Singh, we had COVID care center. In International Fairground. So those are the institutional COVID care center. In institutional COVID care center, a team of doctor remotely look after them, whoever is admitted there, and their food and management is monitored by the uh, government machineries. But in case of home quarantine, it's totally responsibility of the family of the individual. But again, when it is recorded that somebody is in home quarantine, we have to keep the number that which house is home quarantine. Then government supposed to label that house, put a sticker on in front of the house, and there should be some monitoring from government point of view, government side, and there should be 24 into 7 there should be actually 24 into 7 monitoring by the uh, government machinery, say group of doctors remotely, or from administrative officers, a team of administrative officers. But practically what happened, as number of cases are increasing, many of the time it has not been done. It is done by the patient and a doctor, whoever is helping them from outside. So home quarantine is very, very important. This 80, 90%, 90% cases, they may become moderate severe, and from moderate severe they may become severe, and they can also collapse. So this home quarantine management is very, very important from the very first day in proper scenario.
I
Sure.
got two follow. I got two follow-up questions here. First of, I want to ask about the accuracy of the test. How accurate are both the tests, the RAT and the artificial one? Also, if a person is 100% sure, even if like he's symptomatic and he has tested positive, does he go to the hospital? Does he calls a number like the toll free number, or maybe Arigyo Setu? What does the guy do? Does he go to the emergency and they refer him to the COVID care center? Because there's a difference
Yes.
where people don't understand that, but there's a difference between the COVID care centers
Uh,
and
whoever is
hospitals.
whoever is whoever is having COVID, the first identification is done by the government setup, government hospital. This
Hmm,
RAT or RT-PCR is done by the government hospital, and if it is at all done by the private setup, then it is totally monitored by the government setup. Means the report has to go to the main center in Pune, that virology department, government of India monitored virology department, and from there the result actually distributed to the center back, and then only the state is uh, disclosing that person is COVID positive.
hmm.
And your second point is how much this thing
Accuracy.
accuracy. That
Yeah.
RAT, that rapid antigen test, is positive in cases of high viral load. Means if the person is having a certain level of virus, means more than 50% virus
Hmm,
in the sputum, that what we are collecting from nasopharyngeal sputum, we call it, we are taking from the nose or from the deep of the throat, nasopharyngeal we
hmm,
call area. So in that,
hmm.
if their number of virus is more, then only RAT will come, will show positive. They will detect, this test will detect the antigen, we call it virus here. So this is regarding RAT, and it's of course it's accurate. If some anybody's RAT positive, we cannot say there is any fallacy. But if RAT
Mm,
is negative, there is a
mm,
possibility of low viral load cases. So
mm,
if low viral load cases are, how do you know that person is having low viral load? So here the dictum is, if anybody is having symptom, then we'll
mm.
recheck with RT-PCR whether it is a low
Uh-huh.
viral load case having symptom, but RAT is not showing because viral load is not that high up to the level of rapid antigen test. So in that case,
Well,
RT-PCR test
how
has
much
been
does
done.
it cost to get the tests done?
This
And
is
can you do it?
beared by the government. Exact price I don't know, but
So
might
it's
be it is
absolutely
costing
free.
around more than 3,000, and government is bearing it. I think 3,500 or something for
So can you
RT-PCR,
can
and RAT is
okay.
around 500 rupees, and
So
totally
can you
beared by government.
like get tested like just to be sure? Can you get tested every month, maybe?
No, that luxury is not there because it's a very costly test, and we have to cover a huge number of people. So whoever is having symptom or whoever is having history of contact, means somebody has come, I have come in contact with some positive person, then I am supposed to go for the contact screening for RAT or RT-PCR.
Fair
So
enough.
once it is positive, then it has been recorded in government level that this person is positive and that house is having a positive person. So that person will, if that person is having no symptom, he will be
Mm,
allowed to home quarantine. And if he is telling that I am not ready for home quarantine, I have no facility, then he will be put on uh, COVID care
mm,
center, that is CCC, and that is a
mhm,
institutional quarantine.
mhm.
So it is, the number is not that government does not know. Government knows each and every COVID cases where they are. Either they are in home or they are in COVID care center.
They monitor it. Yeah. What is the difference between a COVID care center and a hospital? Because a lot of people confuse them.
Yeah, because COVID care center is only asymptomatic and mild symptomatic case, means mild fever,
Mm,
body ache, then sore throat. That sort of patients are there. Dry cough. That sort of patients are there. But in
mm,
COVID care center, once saturation drop, uh, COVID is actually basically it's a disease totally dependent on oxygen.
mm,
Up to the level of asymptomatic and mild symptomatic, oxygen saturation is maintained. We are
mm,
monitoring the oxygen saturation. We'll see when we'll go through deep of the home quarantine, will come those points. Then
mm,
oxygen saturation is measured gradually. If oxygen saturation is up to the level of 95, the person will be in
mm.
COVID care center, that is
Center. Mm,
institutional quarantine or home quarantine. But if it is coming
absolutely.
down below 95, that is 94 or less, then it is ideal to put that person on in the hospital. And that hospital is known as COVID dedicated hospital. It's a dedicated for
COVID
COVID
dedicated
patient.
hospital.
Non-COVID
Right.
patient cannot be there because of it's a very contagious disease, very infectious disease, and doctors, nurse, staffs, whoever is maintaining their doing duties there, looking after that, they have to maintain protocol with PPE, and it's a really a sort of huge management have to maintain in COVID dedicated hospital.
Fair enough. We got a comment here from Riaz the Burma. He asked about TVSC board exam. He didn't even frame a question here. So I mean, we have a doctor with us. I don't think we're probably gonna we can't come to a conclusion over there. We're probably gonna have another broadcast later. Uh, please, sir, TBSC is typing again. We can't answer he can't answer it. Maybe he can answer about the medical entrance exam. Do you think that's gonna happen anytime soon? What about the medical students? Do you have any idea? Like the
No,
people who
now
are aspiring
it is already postponed. So now actually
okay.
the crisis is going on. Agartala, we are not aware about the heat so far.
Hmm,
But what is happening in outside Tripura, it's really
hmm,
horror picture is going on, and that picture
uh,
will come in Agartala by next month,
then it's done.
maybe 15th
Which is
or
it?
after that.
Oh,
So now no
so do you
exam, nothing.
anticipating? So
We have to live our life. We have to save our life first.
first, but are you anticipating that sort of like what is happening in Delhi, Maharashtra? Do you think it's gonna come to Agartala anytime soon?
As it is pandemic, it has to come to nook and corner of the globe.
Okay,
That's why it is a pandemic.
but
Pan means
we're
whole
not
part of
even
the
prepared.
globe.
We're not
No,
prepared. Are we prepared?
so actually, what happened last time? Uh, the crisis started in Maharashtra, then Delhi. It was in April, but we got the
Hmm,
hit in Agartala in 15th August to 15th September was peak of Agartala. Means we are getting it if you count from April, May, June, July, August, so 4 months. So like
Oh,
that,
yeah.
Delhi, Mumbai was having that heat this time in January, February. So
Yeah.
from February, and as it
Yeah.
is little rapid, might be within 3 months, Tripura will also get the heat of
Yeah.
COVID-19 second wave. So already
Second
it
way.
started. Our cases have crossed more
But
than
it's
100 per
minimal.
day,
Yeah.
and today we lost one kid of 13 years,
Yeah. That
and
is
that kid
highly
that kid
unfortunate.
reported brought dead in the hospital, and later on we found that it's a COVID positive. So things are changing very fast. So it's a time we should think about how to manage it. And home quarantine is a basic part of COVID management because
Mm.
90% patients do not require hospitalization. They are either totally symptomless, that is asymptomatic, or very, very mild symptomatic. So, mild
Mm.
symptomatic means fever, body ache, sore throat,
Mm.
then dry cough sort of thing, nasal block sort of thing. So they don't require hospitalization. They should be in home quarantine or in institution quarantine, that is in COVID care center. So our
Fair.
concern is today that how to manage, how to proceed for home quarantine. It's a very technical thing. People do not know how to. So we decided that we'll uh, discuss this for the greater service of the humanity.
Yes. So let's say, but before we go into that home quarantine stuff, let's try and understand about the virus a little bit more. There were news on the horizon that the triple mutant and the double mutant has arrived in Agartala, and that is the most like that's a new version of COVID. It's more dangerous. It's more adaptive. What do you have to say about that? Is it here? The
It
double
is, of course,
mutant.
here because already today our scientists, in a press conference, they declared that double strand is here. But this is a totally scientific subject, totally scientific point. Common people should not think about double mutant, double strand, triple strand, and all that things. It's a COVID. COVID is here in Agartala since last year March, and COVID is still here in Agartala. Now it is April and it's a knocking May month, and first wave is finished. We successfully managed first wave, and second wave is knocking. Now we have to manage the second wave. And mutation for virus, mutation is very common. It has to be there. It's just like changing the shirt. Virus is changing the shirt very rapid, like what we are doing. So changing the color. So it is, we are not bothered. Common people should not be bothered about double stain or triple stain. It is the subject of the doctor. It is the subject of the scientist. Only thing today that press conference has been done to aware about the people, because our people are totally unaware. They are moving in the market without mask and not maintaining the distance, social distance at all. Sanitizing of hand is totally not mentioned. As I said last time, I call it social vaccine SMS. S for social distance, M for masking, and second S for sanitization of hand. So this total part is, that is a COVID maintaining COVID behavior, we call it COVID etiquettes. That etiquette is totally missing in Agartala. So to aware people that it is a high time we should be cautious about the coming scenario, this double stain thing has been identified, or press conference they talked about it. And it is not only
Fair,
double
fair.
stain. Already triple stain is also there in Kolkata. It's called Bangalore
Yes, yes,
stain. Yeah.
yes. We're gonna get back to the main topic, home quarantine. Uh, like we have different economic situation over here. Like Tripura is mostly, sorry, India is mostly a rural country. There are a lot of rural areas over here. Its economy is rural. A lot of people live in the rural areas, as well as Tripura, even Tripura as well. So people are less educated over there. Of course, government is trying its best, as well as the district ministers. But if you're economically weak, if you, let's say, you live in a hut or any other, and you probably get the symptoms, you get panicked. So trying to make us understand for the economically weaker section, how do think of that from their perspective, what should they do? Because how do they shut themselves down? A lot of people just live with their own family. They don't have the luxury of locking themselves out in a different room. What should they do specifically to home quarantine?
Actually, that home quarantine is whether economically down or economically high, whether it is Amitabh Bachchan or whether it is me, whether it is somebody else who is staying in Takarjala village, for everybody it's same. It says home quarantine. The home is quarantine. Quarantine means nobody can come from outside and nobody can come from home to outside. So we have to maintain the quarantine of the house. So how to do this? That is important. To make it the house home quarantine, first of all, we have to lock the house. Gate should be locked. Nobody should go outside and nobody should come from outside. Why nobody should come from outside? Because if they're coming out inside the house, they will get the COVID virus, coronavirus causing the COVID-19 disease. So they may get infection. And why the people who are inside the house, they will not go out? Because if they go out, they will spread the virus in the society, in the community. So this is the conception of home quarantine. And as you said, heart. If somebody is in the heart, it's a good thing because airy houses are better than sealed houses. So in luxurious houses are not ideal for COVID patient. Heart is better for COVID patient. And if then now how to maintain the dignity of the house in a COVID quarantine home quarantine management? The person, as you said, if one person is COVID positive, then how they will do, what they will do. Now, if one person is COVID positive, that person should be isolated in a single room. If that luxury is not there, then and mixing this person is mixing with other people, then I tell my patients, whoever is contacting me, and I wrote in my article also, then we should consider the whole house is COVID positive, means whoever inside the house should behave like COVID positive. They should. And how they will behave, they will not mix up with each other. As long as possible, they will be maintaining social distance inside the house from one another. If individual bedroom is not there, they will try to sleep separately in separate beds. And if possible, the person who is having COVID positive will use a different toilet. And if it is not possible, if they are using a common toilet for everybody, then we have to maintain a dignity of the toilet. Means whenever somebody is going to toilet, whether it is COVID positive or COVID not positive, mask should be there inside the toilet, because stool is a huge source of spreading COVID virus. And when person is passing stool in the toilet, there is a chance of virus inside the toilet. So whoever is going next, that person should not get that virus by inhalation, by respiration. So
Hmm.
inside the toilet, mask should be there. And when,
Hmm.
if it is a English commode, then the lid should be covered first,
That
then
should be
give the
done.
flush. There should not be flushing of the air, so that
Right.
the spreading of virus should be less. So that sort of dignity in the toilet, dignity in the house we should maintain. And house should be cleaned properly. The bed linens, mean bed cover, bed sheet, pillow cover, should be changed very frequently, because this virus is surviving in the rough surface for one day, and in a steel surface for a maximum up to 3 days. So we need to clean the house properly, so that if same person is not getting virus from other sources, so
Hmm.
means one person should not spread and other person should not inhale it. So
Got it.
that house management is very very important. If I repeat
Another.
it, every person should consider COVID positive inside the house, because the house is
Absolutely.
less. And if they
Yeah.
have a luxury of separate bedroom, then they should be
Get
confined in
it. Get it.
separate
Separate.
bedroom. But it's
Right.
not
Right. Right.
possible in many of the cases.
you know Another thing that comes to my mind is the rationing part, because usually when you're home quarantining, somebody needs to go out to get food, somebody needs to go out, get the essentials and everything else. uh, how do people manage? What is your suggestion? How can somebody manage that situation? It's certainly not the patient. The patient can't go out 100%, but how can like do we call the government? Who takes the action here?
Yeah, diet is very, very important. As you highlighted nicely, it's a very good point. Diet is very, very important. There should be nutritious diet, and because it's a viral disease is related with the individual immunity, and immunity is depending on the diet. So during that period, all family members, particularly who are labeled COVID positive, they have to have a very good nutrition, and who are not labeled COVID positive but confined, quarantined in the house because they are the member of the house, they also should have a good food. So means good food means uh, sufficient fruits should be there, sufficient green vegetable, particularly green leafy vegetable should be there, fish, egg, milk, if possible meat, sort of healthy diet should be there, and that any member of the house cannot go outside to purchase it. So it has to be supplied from outside. So who will do this? If government is taking responsibility, they should do this. But in our country of 140 crores, this luxury is not. We did not have this luxury for many states and many parts. Even in Tripura, it was not possible. When I had COVID, I did not get a single phone call from any part of the machineries, that whether I require any support or not. But I maintain with online services. I got service from Niharika. I got service from another. I forgot now. So lots of in a Google you can search. So online you can, or your relative or your neighbor, your friends can hang some bag in your house according to your demand. If you require potato, if you require egg, if you require rice, bread, butter, or if you require fish, that should be supplied. That supply chain should be very, very intake. Otherwise, nutrition cannot be maintained. If government is doing fine, if government is not doing, your relative, friends, or if at all nobody is doing, then you can ask your neighbor. And neighbor, most of the cases, they take very good care of COVID houses, because there's a war going on. We have to help each other. We should look after each other. So this the diet is, as you said, is very, very important, and that
Mhm.
ration maintaining is very important. And
Mm.
next is, uh, I believe hygiene is also important. How to maintain that hygiene, isn't it,
Mhm.
Saurabh? That
Yes, absolutely.
we should not spit around in the house, because if anybody is spitting, the virus is coming out from the respiratory system, from the lungs. So we should
Mhm.
maintain hygiene of the house, hygiene of the room. We should not,
Mhm.
and garbage. Another very important thing is garbage. Garbage, generally, what we do, we throw it
Throw
ourselves,
things out. Yeah. You
ourselves.
eat a
But during
banana
that time,
peel.
you cannot
You
go
eat a
out.
banana, you throw it out. Yeah.
Exactly, you cannot go out. And municipality guy who is coming in the municipal area, he will also not. He may not enter in your house. So you
Hmm.
can tie up the thing that you will put your garbage in the gate, and he will come and collect it. And if it is not done, or because of some lack of guidance, they are not ready to do this. But actually, if somebody is cleaning your garbage, it's not a harm. They are not doing
Hmm.
any harm, because corona is not going through your garbage, because it's a contamination. If anybody is handling your garbage, can wash the hand with 20 seconds with soap and water, and corona will go off.
Cool.
And if you otherwise, if nobody is there to take it out from a house for 14 days, you should have some place in a house where you will keep your garbage intact.
Dispose of
And
this. Yeah.
after, yeah, after that, after 14 days, you can throw it out. But you should not throw it in the community, and you should not spit outside your house, and inside
Hmm.
house also you should not spit around. And particularly taking bath is very important. Regular bath is important. If one is
Hmm.
not taking care of personal hygiene, then the person may get secondary infection, because of immunity is already down by the viral infection. So bacteria may, or fungus may attack the body. So we may
Got
get
it.
secondary infection, you call it.
Got it. So now, I would really like to call upon the attention of the government or the administration, particularly in this topic. If I believe someone's socio-political, like economical status should be, not political, sorry, socio-economic status should be considered when they are tested. if somebody is unable to be, home quarantined, because there are a lot of people who live alone, a lot of students out there. Yeah, could you imagine a student living outside the limo? I mean, it's really, people can't think of it anyways, and uh, whether he's living in rural or, administration should monitor it and assist them to either home quarantine, or shift them to a better, CCC as
Here
well.
I have a point, Saurabh.
Yes.
Administration and government, every time we are blaming, actually, it's a blame game sort of for every incident, not only COVID. But why can't we locals take care of each other? Being a
Because
person in
again,
the community, I can take responsibility of my any of the houses whoever is getting positive. I can ask them, hello, Mr.
yeah,
X, do you want anything? Can I buy something for you? Or do you want any help? Please give me a call, I will call the doctor inside your for your help. Sort of thing we
yeah.
can do. And another important body is there who are not at all involved in the first wave. I have not seen much involvement from that club we call in our area.
Mm,
Every area is having club. They are doing lots
mm.
of Durga Pujas, Kali Pujas, and Ganesh Puja, Ganpati
Absolutely,
Puja. This club can
absolutely.
take responsibility,
These
isn't it?
clubs come to, like, every time they ask for money, and I'm pretty much, last time even with Corona, they asked for the deposits and all of that. Where are those people? Why aren't they taking initiative? They're just, shedding. Some clubs are doing their part as well. They're giving rations and all of that, but that's not the only thing. You should take care of these things as well. That's a great point that you mentioned. But we need to move forward.
Ration was up to the level of selfie only. That ration part has stopped. Once
Yeah,
that selfie
okay.
chapter has closed, that ration part has closed. Actually, ration
Yeah.
is also not important. Whoever is inside the house in home quarantine, they have enough stock for them
Mm,
monetarily. Only thing I require, what I felt, you require somebody from outside to keep the supply intake. Say you require
mm,
a bread, say you
mm.
require 1 kg of atta for your making roti, or you require
Yeah.
potato, simple potato and onion supply is also very very important. Club people can make a group, and every club is having say, 100 houses in their area or 150 houses in their area. So if they
Mm.
monitor whoever is positive in my area, we look after them. They can at least one person can come in front of around and ask, hey, Shaurav, how are you? Don't feel alone. We are outside. We are giving you support. That is
Mm.
too good a
That is
moral
good.
support on that time.
Even the emotional support is, good. Like,
Yes,
mental health is a huge topic. We
yes,
talked
very
about this
important.
last time, but let's
Yes,
touch it on like on home quarantine perspective. If somebody has chosen that path, that, we're
monitoring is
gonna,
important. How to
yeah,
monitor?
how do you check your mental health as well? Let's start with mental health, that we're
Sure.
talking, then we're gonna come to, like, the
Physical
physical
monitoring.
conditions. Yeah.
That
How
mental
do we
health,
monitor that?
yeah, last time also you gave lots of stress on that mental pressure, mental health. Very nicely you are highlighting this. This is many time it's actually ignored. Many time it's ignored, but mental health is very very important. If you are mentally down, your immunity will go down. If you are mentally cheered up, your jolly good fellow mentality is there, then of course your immunity will increase. So I tell people that keep on listening music. Good music will give keep alive your mental health. And along with that, you should not go through the media thing. WhatsApp university, Facebook university, you should keep away from those two university who are giving lots of knowledges, and most of the time it's doing less positive thing and more negative thing. So we should away from those two university. And Twitter is again third university, Instagram is again the fourth university. Though I am not very familiar with Twitter and Instagram, I talk about this WhatsApp and uh, Facebook. And another is media interview media, that news channels and all the things. They many a time they are only showing who is dying, and dead bodies are lying outside crematorium, and dead bodies are lying. Uh, I mean, patients are lying unattended in the hospital. That sort of news one should avoid when they are in home quarantine. It's better you go for Doordarshan, and if you have good channels, you go for the channels, see movies, enjoy music, and enjoy your family time, because it's hardly you have time to stay together with all your family member together. Make picnic every day. Make say hello, hi, good morning. We'll enjoy this third day. Like next day you say hello, hi, today is fourth day, we'll finish it off. Like 14th day you enjoy at home. And this really many family they got back together, that how what they were missing. Actually you are leaving early in the morning and coming in the late lunch, breakfast, dinner, nothing you had together. So home quarantine has positive thing also.
Exactly. But what they can do, they can watch tripurainfo.com, they can watch the
Sure.
YouTube channel, all that. It's the only place where you cannot get negative news. You can get these sort of productive discussion that we really do need. Keep yourself informed, keep your head held high, and it's going to work out in the end of the day. Let's
Yeah,
go to the
I must say one thing. As you said, tripurainfo.com. uh, of course, I am sitting in this platform not for that reason. Tripurainfo.com is not giving any negative newses, because if they are giving newses, negative newses, I won't have come here so positively. And this is my second visit, and I already told MD Mr. Jayanta that if you call me, I'll come again and again to serve to the humanity. And tripurainfo.com is doing it so nicely.
pretty nice.
Thanks to
No,
thanks
I
to the
really thank you. I appreciate your time as well. You took out time from your very busy schedule. It's a nice thing that you're doing, informing other people. That is our intention. But let's go to the physical monitoring now. Let's start with the temperature, because that's something that you start to notice. And the second aspect is the oxygen level. You asked for the pulse
pulse oximeter.
oximeter. But if you're from the rural area, you probably can't you know afford a pulse oximeter. How do you manually, is there a technique to manually sort of check, okay, things are now getting out of control, let me call the ambulance?
I'll divide it in two parts. One is clinical aspect and another is instrument based aspect. As you mentioned, rural part, they may not have instrument. Instrument wise, we require only two instruments. One is thermometer and another is pulse oximeter. Thermometer is costing around, I think, 40-50 rupees uh, at present. And pulse oximeter is costing say 1000 to 5000 rupees. So 1000 rupees, 1500 rupees is available in the market. And clinical based, I'll give more stress because I am from Tripura. I am from a rural state. It is one of the poorest state of India, and that's why I always believe that clinical uh, approach to a patient is time saving for us, money saving for us, which is easily manageable by the patient and the family. So clinical point, we'll see temperature. We can see the temperature by touching the scalp like this. You can see the temperature, and you can manage the pulse rate by counting the pulse rate, putting your this forefinger like this, covering your wrist. In this part you touch and you count 1 2 3 4 like that in 1 minute how much pulse is coming. And respiratory rate you can count. Lie down straight in the bed, lie down straight in the bed, and then you put your hand in the abdomen. You put your hand in the abdomen, and then gradually count your respiratory rate, means up down of the abdomen in a minute. This is actually respiratory rate. And normal respiratory rate should be 16 to 20, and normal temperature should be less than 98. So those are the very easy thing. If you can see in pulse, means pulse, if it is going more than 90, might be the patient is having some fever. If it is more than 100, you can take the cutoff as 100. If it is 100, then of course there is a fever is there. And if pulse, this respiratory rate when you are lying straight in the bed and putting your hand in the abdomen like this, and seeing the up and down of the abdominal wall, that is the respiratory rate. And your respiratory rate is more than 20, it is mild symptomatic case, means up to 20 to 24. If it is more than 25 respiratory rate, then it is moderate up to 30. And respiratory rate is more than 30, it's a severe case. Like that pulse, if it is more than 100, it's a mild case. If it is more than 110, it's a moderate case. And if temperature is maintaining, means pulse rate is maintaining more than 110 per minute for certain days, more than 2-3 days, then might be it is turning from moderate to severe cases. And pulse oximeter is a machine. If you put on index finger or in the middle finger without nail polish, and the nail should be trimmed properly up to the level of the skin, and you put the pulse oximeter and see the reading. This is the machine. And temperature you can see in your axillary area. They're putting for 2 minutes with the instrument. And clinically, I said you can measure temperature by seeing the pulse rate. And pulse oximeter you can see with the machine, and without machine how will see with the respiratory rate. If respiratory rate is going more than 20, it is mild case. More than 25, moderate case. More than 30, it's severe case. And how do you know that oxygen saturation means lung capacity? Oxygen saturation, what we are seeing? We are seeing the lung capacity, how much lung is affected by the pneumonia. COVID is nothing. COVID is actually thromboembolic pneumonia. Because of the viral activity, there are tiny dots, tiny clots in the blood. We call it thrombi. This thromboembolic, this thrombi is or gathering in the lungs wall. Lungs is covered by membrane. In the membrane they are adhered, they are getting attached, and they're uh, uh, stopping the exchange of air in the lung. Means that COVID-19 is a thromboembolic disease, and this is actually disturbing in gaseous exchange. Means oxygen is not coming inside and carbon dioxide is not going out properly. So ultimately body is getting disturbed. Mechanism is respiration mechanism is getting disturbed. So means when you are trying to hold your breath, you cannot hold your breath. Now if you and me we try, we can hold our breath up to 1 minute. But if your lung is affected in moderate level, you cannot hold your breath for 30 seconds. If your lung is more affected, you cannot hold your breath even for 20 seconds. So if you check your how much time you can hold your breath, like this, hold, ready, 1 2 3. So like this you hold your breath and see how long you can hold your breath. If you can hold your breath up to 1 minute, means your lung is functioning well, your saturation, oxygen saturation is all right inside the body. If you cannot maintain up to 1 minute, means it is coming down to 40 second or 30 second, you discuss with the doctor that my oxygen, my breath holding time has come down to 30 second. If it is less than that, of course you call a doctor, and then the doctor will decide according to your age whether this 30 second is appropriate for you. If you are elderly aged, then 30 second is appropriate, may be appropriate for you. If you are young man, may not be appropriate for you, like that. So the simple thing, clinically and with the machine of thermometer and pulse oximeter, we can assess the severity at home, sitting at home.
Got it. A lot of people, let me just get to this question. A lot of people are sort of taking this home quarantine a little to their advantage. Alcoholics are claiming alcohol, cleans the coronavirus out of your system. Smokers are claiming that cigarette smokes or even marijuana is good for your lungs and it's protecting coronavirus. What do you have to say to the addicts? Because it's really difficult for them to quit it at the moment, but they do also need protection. Are they in a vulnerable position? And if they are, how do they tackle it?
They are definitely in vulnerable position, because whoever is having smoking, whoever is having drinks regularly, or whoever is having marijuana, their immunity has already in the lower level, and corona affects only the low immunity person, attacks only the low immunity person. If they cannot quit during that period, then they should think of quitting their life. Means it is up to them whether they want to quit their life or they want to quit their cigarette or their drinks. So this cannot go together. There is no science supported all that nonsense flown in the media that alcohol will clear the mouth.
The actual news channels cover it.
Yeah.
This
Many
proves
news
that
channels are
people take that
behaving
to
like
advantage.
universities nowadays. News channels, the news channel, they know better than any scientist, better than any doctor, any clinician. Like you
Yeah.
see that Remdesivir crisis is going, and I'll come to that point before this thing.
Yeah, I
Before
wanted
that,
to ask you
before
about that.
yeah, before that, I want to come. I mentioned about, as you asked, the pulse oximeter. The pulse
Mm,
oximeter is very very important. If in rural area you are not having, sorry to say, and sorry to for that particular family, but I taught them how to manage without pulse oximeter. But if you are having pulse oximeter, then you put your pulse oximeter and see your saturation, oxygen saturation. It will show. If it is more than
mm.
95, it's normal. But if it is
Got it.
coming less than 94, means
Mm,
hospitalization is very very much required.
mm.
So
Got it.
before that, there is one very very important test, a 6 minute walking test. You
Walking test.
uh, check oxygen saturation in the base
Mm,
level before
mm,
starting walking. Then you start walking inside the house, inside
mm,
the room for 6 minutes. After 6 minutes, if the drop is more than 4%, means
mm,
if it was 96, now after 6 minutes it is coming to 92, then this person is leading for emergency.
mm,
And in between, in 3 minutes, if he's checking, and 3 minutes itself, instead of waiting for 6 minutes, 3 minutes itself, it's coming to 4% reduction, means 96 to 92. Then the emergency is heading, knocking the door. It's very near. So we should think immediately. We should call the doctor and think about hospitalization. Think about other sort of immunities, money, friends, all sort of requirements are there before going to the hospital. So this 6 minute walking test is very very important, and it's a one of the ideal thing to avoid emergency at home. In home quarantine, it's very very important.
mm.
And
Got
what
it.
was their question before that? I just interrupted with
I
six
think
minute walking test. I wanted
it's
to
okay.
mention.
I mean, you already addressed it, the alcohol one. You addressed it.
Yeah,
Let's
yeah.
move on to the next one. You already talked about the diet a little. You said a rich diet
Hygiene.
is
We
important.
covered
Yeah,
diet. We covered hygiene. Then monitoring.
absolutely.
Then what sort of
Let's talk
medicine?
about let's talk about the Remdesivir crisis that we are seeing. Why is it? Why is there a crisis? I thought that these medications are well produced in India.
Yeah, Remdesivir is actually invented for hepatitis C. It's a viral antiviral medicine, and then
Mm,
it is tried in between for Ebola virus, but that did not work. And this time, scientists found that Remdesivir is working on COVID virus, that is the coronavirus causing COVID-19 disease. But this Remdesivir is actually not very useful. Now it's already proved by recovery trial conducted by the United Kingdom. This recovery trial has shown this remdesivir is not life saving. It's not reducing the mortality, that is the death rate. It's only reducing the hospital stay by 2 3 days. But the crisis has gone up to that level. Now doctors are also helpless. Patients are asking, "Have you given remdesivir to my patient?" So if you do
mm,
not give remdesivir, and this is a viral disease, we do not know who will collapse and who will not. Then
mm,
next the blame will come to the hospital. Then maybe there will be another incident. This hospital is broken by the patient party, which is very common nowadays in India. It's very easy to beat a doctor. Wherever whatever happens, you just beat a doctor or a nurse coming inside. And for remdesivir, there was ransack case in some part of, I think, Haryana or Rajasthan. I think
mm.
Delhi. Sorry, in Delhi it happened. So remdesivir was not available, and doctor said it is not required. Ultimately, the patient died, and the patient party later on, after 4 hours of declaring death, they came inside the hospital, and there was all blood around inside the hospital of the blood of the doctor and the nurses. So as you said,
Yeah,
as you were asking that remdesivir, I again emphasize, remdesivir is not
it's not
life
needed.
saving. Remdesivir
Yeah,
is needed, but it has some specific indication. It should be given in first 7 days, if at all giving, maximum
yeah.
within 9 days, because this virus is replicating, increasing in number in first 9 days. After 9 days, this virus will stop replicating, means increasing in number, and this virus will not even culturable. Means after 9 days, this virus
Okay,
we can
even
declare
even
as
for
death.
even for like rabies, they have the Milwaukee Protocol. So if you don't take vaccination for rabies, you can do the Milwaukee Protocol, and there is a shot. But there is the very last moment when you can't do anything, you do the Milwaukee Protocol, and maybe the guy is saved. Do we did we have certain medications for asymptomatic people, but what do the doctors do at the very last moment? What, like, do they electric, like that electrication, the CPR, what do they do at the very last moment? I want to understand.
In asymptomatic cases and mild symptomatic cases, asymptomatic cases they do not require any medicine, and mild symptomatic cases they may require medicine like paracetamol 650 milligram to manage the fever. In fever is not coming down with paracetamol, then we can think of mefenamic acid or pyroxicam to reduce the fever, and along with the fever there is another headache, is body ache, malaise, that all reduces better with the mefenamic acid or pyroxicam. So that sort of treatment is enough for home quarantine. Basic thing in home quarantine is good food, good hygiene, good sleep, and good mental health. And along with that, if fever, address the fever with paracetamol. If body ache, address the body ache with paracetamol. If it is not reducing with paracetamol, then you add on mefenamic acid, which works better with along with paracetamol. And if there is cough, you can prescribe sort of cough suppressant like allergic drug, montelukast sort of drug. And if there
Fair
is
enough.
sleep is disturbed, because of
Melatonin.
COVID-19, sleep is also disturbed. Yeah, melatonin is a very good point. I appreciate your this thing. This
I
melatonin
take
5 milligram.
I personally take melatonin, so I know it works,
Oh,
but
really?
again,
It's a
yeah.
very good medicine for now. It was not available in Agartala thoroughly. Then I rang up to medical shop and I said, "You please keep melatonin in
Altonin
Agartala."
10 5. You can also get it
Altonin,
off
Altonin.
Amazon. Yeah, you can also
Oh,
get
right.
on Amazon as well some,
So this
well-being
melatonin
medicines.
actually suppressing the viral replication. As I said, this COVID virus is replicating in the first 9 days. After 9 days, it is not replicating, means not increasing in number. It is not even culturable in cultural media, means the virus is, we can declare dead after 9th day. And this
90 day.
replication is actually suppressed by melatonin. So melatonin is
Mm.
very helpful. Then we can think about your I said other thing, like if any cough is more, then we can think about doxycycline. If doxycycline is already given, then we can think about azithromycin. Why doxycycline? Because doxycycline is actually having some antiviral action, and it
Okay.
some study has shown that this doxycycline works better with COVID-19 virus, coronavirus. But it is not approved or any guideline has shown. It is all over-the-counter medicine, and many a time we are also prescribing vitamin C, vitamin D. Why vitamin C? Because vitamin C increases the immunity.
Increases
So
immunity.
500
Yeah.
milligram 2 times you can take in home quarantine. Then vitamin D again, it increases immunity immediately. So vitamin D 60,000 unit, international unit can be given weekly during that period. But those are not recommended by any body, or those are not recommended by any guideline uh, of any country
But
or
it's safe
any
to take.
one. But we can
But
give
it's
it.
safe to
But
take. Yeah.
too many, not safe we can say, but so far nobody said it's not bad. So, and again you said you are asking about mental health. During that period, if somebody is asking from home quarantine, doctor, I want some medicine, and if you say no, you do not require any medicine, then might be that patient will, the person will think this doctor does
Anxious
not know
anxiety is a
anything.
different issue. Yeah,
So it's
you're
better
right.
you give some vitamin C, vitamin D, then paracetamol SOS, then cough suppression SOS sort of thing. And nebulization is very, very important that part. If one can manage nebulizer machine, which is costing around 1500, 1600 rupees, that budesonide nebulization twice in a day, one can easily take it at home with a plugging in a electric socket, and this machine can be cleaned very easily. One can take YouTube support also how to use it and how to clean it.
Yeah,
And
for
if
for
one
breath
cannot
cleaning.
have budesonide uh, nebulization machine, then can have as an inhaler. This local steroid is helping, And it is also some study very recently, in last month only, this month only, in the first week
Do
it
you
is
mean the
published.
asthma
Yes.
inhaler, the kind of inhaler they use in
Yeah,
asthma?
that is the inhaler. That inhaler, budesonide inhaler. It's a local steroid inhaler. It helps
Oh.
in COVID-19 mild symptomatic cases. Helps a lot. But once
Mhm.
it is moderate and severe, they hardly found any effect on those things.
Great.
So those are the basic management. But we should stop before oxygen and steroid and low molecular heparin. Oxygen, steroid, and low molecular heparin, those three are the main treatment for COVID-19 cases who are in moderate symptomatic or who are in uh, uh, severe symptomatic cases. So this sort of treatment should not be given in home quarantine. I never encourage those things
Hmm.
because the maintaining deteriorating, monitoring a deteriorating case is very tough. And you were asking about
Understood.
remdesivir. Remdesivir should not be given in home quarantine. Already it's an
Absolutely not. Yeah, you need a
international concern
monitor.
is there.
Yeah.
Yeah, there may be
And
medical legal case against the doctor. So one doctor should not prescribe remdesivir in home quarantine cases. And as I started with that today's program, that we lost one 13-year-old girl today, and this girl was brought dead in the hospital, and it's very pathetic. That means that home quarantine or home treatment, whatever they were doing, it was so late. That late reporting is very, very important. Late reporting is the highest cause of mortality. Means increasing rate of death in COVID-19 cases.
fair enough. I think we covered almost all the topic in question. We are almost about to hit the hour mark. Uh, this is a difficult time. This is a different time. We are losing lives. Some of them familiar faces. Some of them uh, a little unusual because 13-year-old kids shouldn't die out of this sort of thing. But in the end of the day, a life is a life is a life. So we need to make sure that everybody is safe. Up until we are all safe, we cannot rule this one out. This is very important. So having
Vaccine.
said,
Vaccine is important.
vaccine is absolutely important. We
Very, very
talked about
important.
that. Yeah, get vaccinated, everybody.
Last time
Stay
we covered a
safe.
lot.
Yes. And, if you haven't checked out the last broadcast, just scroll through the feed. You can have our last broadcast as well. I'm going to ask, the Tripura info guys back there in Agartala to create a playlist of these videos so that you can access these videos easily. But before we go, I want to say, stay safe, stay quarantined, and wear a mask, and always stay clean, because you are transmitting something that you don't even know the gravitas of. Mr. Ghosh, thank you very much for being here for the second time. I hope I have the opportunity to interview you in the future as well. But for now, it's a goodbye. Stay safe.
Thank you.